How does COVID impact elderly population, and why are they affected, you know, uh, more seriously than others? Actually, it is basically because our immune system wanes, as we grow older. Its ability to fight infections better decreases. Also, elderly populations have more health conditions like diabetes, heart problems, cholesterol problems, that can predispose them to have more serious effects when they get the infection. Other considerations would be that they're more dependent on other people. So with this COVID pandemic, there's a lot of isolation that happens, physically, socially. So aside from the disease itself, other conditions also flare up, like loneliness, depression. So they're more affected compared to other individuals.
Can can I add something, Dr. Lau? Or
Yeah. Sorry.
Dr. Glenn, are you on? Are you
Can you
on
hear
with
me?
us? Yes.
Yes.
Okay, a little technical
Okay.
difficulty there. Please continue.
Yes. Oh, no. So I was just going to add on to what Dr. Lau was saying. I think the population that I see, which is primarily those in the home setting, require a lot more assistance from others for doing their daily activities. So it's very hard and for someone to remain isolated when they need help even to get to the bathroom or to be given food to eat. So definitely social distancing is a lot more difficult in that situation. And so I think that does put at least that part of the population at slightly higher risk.
Let me just pause for 1 second and do a brief intro. Ladies and gentlemen, thank you for joining us. I apologize for the technical difficulties just when you think everything's working perfectly. Real quick, we have with us as our guest today, Dr. Eugene Lau, who is a practicing family physician at Kauai Medical Clinic and who also manages patients in nursing homes there. Dr. Winnie Suen, who grew up in Hawaii. She attended the John A. Burns School of Medicine, did her fellowship training in Boston, and has now returned to Hawaii working as a geriatrician. She is pioneering the primary care at home program, does a lot of house calls, and helps to take care of many kupuna at home. Dr. Yazawa is a geriatrician with us here at Straub, who also is the medical director for 4 different healthcare facilities. He is also working with the Hawaii State Emergency Management Association to help with the COVID response in long-term care facilities across the state. So he has a lot of expertise in this area. We look forward to hearing more about that. Ladies and gentlemen, I know this is a tough time for everyone because of coronavirus, and we hope to be able to answer a lot of your questions today with our expert panel. And you've already started talking about some of these, but let me just continue the conversation. Dr. Suen, you were talking about some of the risk factors. Could we just briefly talk for a moment about what it is that, about what patients are highest risk for coronavirus at this point?
Certainly, when you look at the stats, and it's somewhat scary that you see a lot of our older adults on the higher end of the age spectrum that seem to be affected more from a death standpoint. But I have had, some of my 90-year-olds survive and or be asymptomatic from COVID. So it really is in some ways a really wide spectrum of responses. So age isn't everything, although as Dr. Lau mentioned, I think as we get older, that some of us tend to have more chronic illnesses and or some acute illnesses, but some chronic illnesses that put our immune system at risk, and so it makes it more difficult for us to fight some of these viruses.
So let's assume that one of our family members is elderly and may have some other risk factors, high blood pressure, diabetes, obesity. Dr. Lau, what are some things that families can do to minimize the risk of exposure for our elderly family members?
So first thing is try to limit going out of the house. If it's not necessary, just stay within your house and around the house. You can do exercise there. The other thing is limit contact with people who always go out. If you live with an elderly person. You have to think that when you go out, treat other people as if they are positive for COVID so that you are more careful with your interactions. Just following the basic rules of keeping yourself 6 feet from another person, making sure that you're masking up properly, and washing your hands regularly. So far, those are the only things that we have. Until we get a vaccine or medication available, I think we should rely on those practices. Now, if you are thinking, I have to work, I have to run errands, make sure that whatever you do, you think about those things. 6 feet apart, mostly um, washing your hands, facial coverings. I think for now, that's all we can do.
So Dr. Lau and Dr. Suen, one of the biggest questions we've had from our audience is, what do I do if a family member tests positive? How do we handle that situation at home?
Dr.
Dr.
Lau, you
Suen,
want to
if
go?
you don't mind.
Or I'll go first. Okay.
Yeah, you can go.
So if someone does test positive and you have a home that's big enough where you can either somehow figure out a way to isolate from them, where they have their own room, their own bathroom, and then do a lot of cleaning in that area, if that's possible, then that would be advised. If that's not possible, I know Dr. Yazawa also has some information about where I think the state has set up some places where people can go and quarantine.
So just to add to that, if, for example, you live in a multi-generation home and someone is sick, you couldn't really isolate them from others. What you can do is just limit um, where they can go inside the house. So just limit them in their own room, assign someone who basically will do everything like cooking, cleaning, someone whose immune system is also not weak, someone who doesn't need to go out. Um, and then limit the utensils that they're using. Do not share it with other people. Someone who's sick should follow the guidelines on when they can finish their isolation, if for example they're asymptomatic, um, because other people within the home can get sick from it too. So I think that's also what CDC is recommending. Assign one person to take care of the sick person. Make sure that you isolate them in their own house or in their own room. Limit exposure to other people. If they are within, other people, we need to make sure that the others are wearing a mask, that you clean the surfaces regularly, not share utensils, and make sure that the room is well ventilated. So, it doesn't become stuffy, and, other things can occur at that time.
Yeah,
And
I want to reiterate what Dr. Lau is saying. He talks about wearing masks and social distancing and washing hands, but they've really proven effective in nursing homes where we've had outbreaks. We're really just doing the same thing. And we were able to, number one, have outbreaks where the staff continue to care for patients wearing appropriate protection and masking and not having the virus spread to the staff, and being able to control it even within a nursing home environment by doing much of what Dr. Lau is and Dr. Suen has been speaking about.
it sounds like we repeat ourselves a lot when we focus on masks and disinfection, but we know these things actually really do work. Dr. Yazawa, speaking of nursing homes, I know that some of our audience members may have family who are currently in a care home or nursing home and may be concerned about that. Can you talk about what the state is doing right now to help reduce risk to patients in those settings?
Well, as you know, most nursing homes have been under quite severe lockdown since about March or April with no visitor policy. I know that the assisted living facilities and some of the care homes have been a little bit more liberal with that. We're in the middle of our third week of a second lockdown where I think we are not allowing visitors again. That's one way. We are doing weekly testing of all staff, at least in their nursing homes. We're trying to arrange similar type of testing for the care homes and foster homes as well. Some of the assisted living facilities have already followed suit and financed their own type of testing as a way to check if the staff are bringing in COVID. We screen all the staff every day, 2 or 3 times a day in some places, to try to preempt early disease. And of course, just like Dr. Lau and Dr. Soon have been talked about, we're masking everybody, and using regular surgical masks, and N95 as needed, um, distancing, hand washing, the basics.
So, we really appreciate all the efforts are being made, and I'm glad to hear about that. One of the questions we're getting from our audience, in whatever setting, especially if a kupuna is living alone or if they're in a nursing home facility, they run the risk of feeling very isolated and depressed. How do we prevent social distancing from becoming social isolation? Dr. Suen, you want to start us off?
Yeah, so some of my patients that I've seen in the home certainly do live alone. Their children do come and stop by as best they can and interact with them in as safe as a manner as possible. So they have some interaction there. During the other times when they can't stop by, they have used technology. They've set up iPads or iPhones or even just the phone, and set up times where they know that they will be checked in on. Some other family members will even put videos, and of course the Kupuna probably should agree to this, that some of these security camera videos you can talk through. And so as long as the Kupuna isn't scared about that, that is another way they can interact. But setting up time to meet up. I've also had some family members do social hours or happy hours, so they know, and it doesn't have to be alcoholic, but you can do other activities during that social hours, including exercise, and yeah, interact, have cooking sessions, eat together. There are other ways to join up with the help of technology.
It's amazing what you can actually do over a live video link. We celebrated my father's entire birthday party on an iPad, and all of us just called in, and he was able to use that at the care home he was in. Other thoughts from our panel?
I do agree with Winnie about that. The other thing is setting up a schedule that you follow regularly to set a sense of normalcy for our kupunas, like incorporating them into if you live with them at home and you're trying to do physical distancing but not social isolation. The other thing that you can do is set a schedule where you can incorporate them in house chores or activities, simple activities like folding like clothes or doing yard work or walking around the perimeter of the house. Um, it's kind of toss up when they say you don't want to have them interact with kids. There's always that concern that kids can transfer the virus to our kupuna, but if they are being homeschooled, you can also incorporate activities where the grandkids are interacting with their grandparents so that it would be a fun activity for both. It has been shown in different settings, like especially in nursing homes in Europe, where there are daycare centers that work with our kupuna. So if you have kids at home and they're just homeschooled, you're sure they're not being exposed outside. I think setting up an interaction with them, a playtime, would be very fulfilling for them.
One of the questions we got from our audience pertains to, what about grandkids who don't live in the same household with grandma or grandpa? How can we facilitate interaction with grandchildren that doesn't involve the kiss and the hug that we all kind of miss at this point? Any other thoughts?
I think just taking advantage of technology. There are kupunas who are hard of hearing. Something that they can do is get like a headset like this and play the video in a bigger screen. Now, like televisions can show videos directly from your phone, so making it accessible for everyone. I think for the time being, that's the only thing we can do. And sometimes, people visit their relatives and just stand outside, or they wear a mask just to talk to their loved ones. I think that's also something that they can do if they want to visit them.
And I think cards and gifts, kids can make things for their kupuna that they can send. There are other ways that they can show their love and get involved, make a lei for grandma, that kind of thing, where kids can actually show how they feel about grandma and still have a phone conversation and celebrate birthdays and important events and include the kupuna in that without putting them at risk. Thank you all very much. Another question that's come up in all these areas is, how can our Kupuna get enough exercise during this lockdown time? How do they stay physically active?
So some of my folks have actually been engaging in YouTube videos and finding exercise that's safe for them to do. I mean, we don't want to go too crazy on some of the exercises, but you know, if you follow some of those, just be careful about balance and not kicking too far up in the air, or, you know, so just be careful with some of those exercises. But some of them are quite fun that they're showing on YouTube, and they're free. So that's some of what, you know, some of my folks are doing. The other part is, if you're able to go outside in a socially distanced manner and are stable enough to do so, that is another great way to exercise, get some fresh air, as well as I think it's a mood booster to be able to get some sunlight. So.
Yep, and for right now, at least solo activity is available. So for any of our Kupuna who can, a walk in the park, a walk on the beach is a great way to sort of wind down and feel relaxed and enjoy nature. One of the other big questions we've gotten is, during this time, is it safe to go to the doctor? How do we meet the medical needs of our Kupuna? And Dr. Lau, maybe you could talk a little bit about telemedicine and how we're using that approach.
Sure. So nowadays, there are systems in place, especially here at HPH, here in Kauai. We're doing telephone visits or video visits. All you have to do is call our clinic, call your primary care physician. They can interact with you if you have any concerns through the phone. If you're scared of coming to the clinic, we can also take advantage of videos on your cell phone. We can also do e-visits through your MyChart, through the computer. You can send us questions. If there are issues that really need to be seen, you know, there are safety precautions in place at our clinic where you are screened. We have contagious rooms. If, for example, you have a cough, you have a cold, and you're concerned, and you want it to be checked, I will recommend that you call your primary care physicians first, so that they will be well prepared and they can advise you on what to do and where to go. Sometimes these things can be managed over the phone. Sometimes if you need to come in, we'll give you instructions. You know, here in our clinic, we advise patients after they check in, they should wait in their car, and we'll bring them up to the rooms if they are if it's their time. And we have, as I've said earlier, like even the urgent care here has their dirty area, so kind of like a dirty area where if we think you have an infection, you stay on that side of the facility to prevent exposure to someone who probably is not having the same symptoms. So I think, you know, best thing to do, call your primary care physician so we can better help you. There's always someone who can talk to you.
Yeah, I know that all of our healthcare facilities are really doing a lot to keep our facilities very clean and make sure that people are socially distancing. So if you need to come to the doctor, it is safe. But we also have a lot of options to help you get treatment at home through telehealth. And Dr. Soon's even doing some work with house calls. Do you want to talk about that just a bit?
Yeah, so for some of my patients who have difficulty leaving their home independently, and it takes a lot of work to get them out. Like today, I went to a home that had, you know, 3 flights of stairs, and somebody who was bedbound. So it's very difficult for some of these folks to obtain care sometimes. So we do have a program here where we can go into the home, and we do screen for symptoms prior to going in, and we do bring our protective equipment, you know, with us to be able to see our patients. But that is an option for some of our older adults who have difficulty leaving their home independently.
So we've talked about a little bit about how we can maintain the physical health of our Kupuna and the social interaction with our Kupuna. Dr. Yazawa, one of the concerns often is, how do we address the mental health of our Kupuna? How do we deal with the fear and the stress and sometimes those feelings of isolation that patients may be experiencing?
You know, that's a good question. I mean, it's really been a challenge for the folks that are in care home facilities, particularly in the nursing homes and assisted living. I think that social interaction is such a critical piece of elder care, and keeping someone mentally healthy and happy is important to the quality of life. So a lot of things that were discussed already, like exercise and social interactions with families, in the nursing homes, they're trying to do window visits in the assisted living facilities, even prior to the second lockdown. We were just starting to do some limited visitations in an outdoor setting uh, to try to keep it as safe as possible with people wearing masks and such. But it is a continuous challenge, and we are starting to see depression, people eating less due to the social isolation that's existing in our nursing homes. So um, yeah, I don't have a good
If
answer
I
for
may
that,
add,
except for what. Yeah, go ahead.
yeah,
Please
if I may
chime in.
add
This is a
something.
tough one.
So I, there are patients and also their loved ones coming into our clinics, and the first thing I tell them is that we need to validate those feelings and make sure that we are aware that those feelings are normal at this point, because we are in a pandemic. We are in a lot of uncertainties. But the thing is, having more information of what we're going through actually gives us more peace of mind, like give us more strength, and it also gives us an idea on what are the things that we can do. Sometimes we just have to reframe their thought process. And like, for example, someone who's so afraid of going out because they might get it because they have a lot of um, you know health conditions, I always tell them that that's true, but we have things in place at this time, like making sure that you wear your mask, cleaning. Those things limit the amount of exposure that you have. And there are safeguards in place. Like, a lot of patients who are feeling depressed, we offer, that's why you can talk to your primary care physician. We can gauge if, for example, you need some professional help, or we can give you some medication. Sometimes just even talking to a professional like a physician actually already takes the weight off of things, because everyone, even your physicians, are undergoing the same stress as you are. And just there are also I think nonprofit organizations, or especially here in Kauai, there is a group of like licensed mental health providers who are giving free, sessions to patients, not necessarily kupunas, to help them manage the stress. Things as simple as exercising every day, maintaining faith-based relations. Church, going to church, going to religious organizations have been a major part of our kupunas, daily routine. Now they couldn't do that. But the thing is, they might not know that their organization have, online faith-based, events. So having them redirect their focus on those, usually those things are very helpful.
Those are all great ideas. I think crafts can be very helpful. It's a great time for other members of the family to look for ideas on YouTube and find things that we can get together and do physically if you're within a household, playing games, building things. If you that with those people that you can safely interact with. We've had a lot of questions submitted by our audience, so I'd like to get to a few of those right now. And I think we've covered a lot of these topics, and unfortunately, we will not have time to answer all of these questions. But I think there's some great ones here. Certainly pertaining to the elderly, how do we address patients who don't understand the risk of coronavirus and why they need to wear a mask? They may have Alzheimer's or dementia. What can we do to help them adapt to these changes that are necessary to protect their safety?
So that one's a hard one, because some of our folks who have memory issues, they forget, or some of them, beyond forgetting, they may not understand why, even if you try to explain to them. But I think many people do understand that what it's like to be sick, and that we don't want them to get sick or want us to get sick. So finding a way to explain it to them in a way they previously could understand as to why you need to do something like wearing a mask could be helpful. Not saying 100%, but that's one way.
So in the clinics, I see people with dementia, and sometimes it's really challenging to have them wear their masks. So what I usually tell their loved ones is that, it's okay to tell them that, hey, give them another reason to wear the mask, because your goal is to actually have them keep the mask on and stay protected. Um, I know it's very, very challenging to discuss with them, like, we have a pandemic, we have COVID. Simple things like, I am sick, I don't want you to get sick, that's why I'm wearing my mask. So it's like, see one, do one. Like, if you're the caregiver and you're wearing a mask and you tell them, I'm sick, I don't want you to get sick, to maybe you wear the mask. Or sometimes as simple as, oh, they're renovating the house, or they're renovating or spraying the hospital, you need to wear a mask because the people who are working there are also wearing a mask. Sometimes that works, but of course, if it's not really necessary to go out, then not going out is your best option. But if you really need to go to the doctor, then if you're having trouble having them wear a mask, be creative. That's the only thing.
Let them decorate their mask, and maybe they'll be proud to wear it.
Yes, that's
Yes.
true.
That one
That's
works
an
for kids
activity.
sometimes. Yes,
Yeah.
it is. The family can get involved with that one too.
Yeah.
We have a question about the death rate from coronavirus. How severe is it here in Hawaii, and what can be done to lower it? Anyone feel comfortable taking that one on?
Maybe Dr. Yazal from the state.
Yeah, I think at one point our positivity rate for the state was extremely high.
Mhm.
Fortunately, we've brought it back down. I think the last positivity rate I saw from the federal government was about 5.1% in Honolulu County. The neighbor islands are under 5%. That's pretty good. That means of all the testing that we're doing, about 5% or less are turning positive. In a sense, the more testing that we do, that number will kind of go down, because prior to the surge testing, what we've been doing is testing clusters that are known clusters. So those numbers were artificially high. Um, with the surge testing, where I think we're getting a more honest look, and 5% is kind of a magic number. Dr. Fauci and CDC talks about when you start to see positivity rates about 5% or less, then schools can reopen. So that's really a magic number for us. When the state has been as high as, I want to say, 9% or so. Above 10%, we're really in trouble. So we've always kind of hung around between 5 and 10. 9 was when we were really worried. And the reason a positivity rate is important is not necessarily about deaths, although those are important. It's about the folks going into the hospital and filling up our hospital beds and filling up our ICU beds and not being available for people who are also sick from other diseases other than COVID, like having a stroke or a heart attack or needing a bypass surgery. And that's when we really get into trouble. So, some people are walking around there saying, well, the chances of dying are pretty low and it's only affecting the elderly, but it's not just about the death, right? It's about our healthcare resources, the availability of beds. If you got in a car accident as a young person and you couldn't go to the hospital because the beds are full with people with COVID, I mean, that's something that would affect you directly. So I, I, I think that's our current state. And I think that second lockdown has made a difference. The challenge will be to continue to keep the positivity rates low with good contact tracing and continued testing.
Yeah, I think one of the things we forget is because we are surrounded by water, if we have a lot of sick people, we can't just ship them across the state lines to another facility. We have to maintain capacity in our healthcare facilities. Fortunately, with over 10,000 cases of COVID, we've only had about 80 deaths. So that's a less than 1% death rate, which is good. But as you said, the biggest risk to us is that if our hospitals become too full and you have an accident or a heart attack, we need there to be a bed for you. So that's why we're trying to manage that. And all the efforts we have are about increasing healthcare capacity and managing our capacity. So I think that's a great question. Another question we got from our audience here is how do we keep our Kupuna? Well, I think we've covered a lot of this as far as depression and positive mood. But are there any particular information you would give high-risk groups? Like we've seen higher incidences of coronavirus in the Micronesian population and multi-generational households. They have to be especially cautious. Is there any advice you would give these households or families?
I think culturally, here in Hawaii, a lot of us are used to engaging with our family members a lot, like shared lunches, dinners, social gatherings. I think if you go down to the basic stuff, if we can limit those, then we decrease the risk of us getting COVID. But then the other thing is, if you are going to be within other people, like your family members, trying to do those activities within 6 feet apart from each other and doing it outside versus inside the house actually decreases the risk. There is a study with the CDC that showed that. You decrease the risk if you are wearing a mask, if you are 6 feet apart compared to if you're not following that, and if you do it outdoors versus indoors. I think a lot of these things happen too because we have an idea that it's not going to happen to me. I'm young. I'm not going to be involved. I'm not working the healthcare field. But honestly, if you abide by the rules, like if you go out of the house and think that everyone has COVID, even the people, my relatives, then it will make you be more careful of how you interact with others.
Thank you. I think that's great advice. We've just a little bit of time left. There's one more important topic I did want to address here from our audience. That's the issue of caregiver burnout. We have a lot of parents, multi-generational households who have kids at home. Even the college students are coming back and living under the same roof. And we've got grandma and grandpa, and we're trying to keep them safe. And so it's driving mom and dad nuts as they're trying to work from home and the children are working from home and we're trying to keep everybody safe. How can we reduce the risk of caregiver burnout, and what can uh, sort of middle generation parents who are trying to manage grandma, grandpa, and the children do to make sure that they have time and resources for themselves?
Well, from my standpoint, from what I can see in some of the homes, they've been, if you can share the burden with others, whether it's somebody you hire to do some work for you, like going grocery shopping, or now there's a lot of online delivery services. I mean, if any of these tasks and chores can be done by others to help out, you could try to arrange them. The caregiving part is hard in terms of physical caregiving, because it's hard to take a break from that unless you have other trained caregivers to be able to sub in. Some of my families in the home have been concerned about other caregivers coming into their home, right? And but they have found ways to make sure that their masks, hand washing, gloves, things like that, to be sure that they're as safe as possible in doing that. So I guess my main message is find help where you can get help. And if your family members within the home can help out, you can have a family meeting about whose chores is doing what, share that burden. And if there is a time or space that you can even get away for a half hour, listen to some music, do something that of your own that you can enjoy, that has also been found to be helpful.
I think those are fantastic ideas.
Can I
Other
add
comments?
something really quick?
Please, please.
There is a website called the elderlyaffairs.com here in Hawaii. You can find resources there if you need ideas. Like there's also respite care. So if, for example, your loved ones need extra help and you really need to take a break, there are facilities that do respite care. Of course, there are costs to that. But another thing that you can think about is hiring someone for just like 1-2 hours a week just to give you a break so that you can recharge. The reason why that's important is because it will reflect on the caregiving that you're providing. If you are stressed out, if you are showing signs that you're already very tired, then the caregiving that you might provide will not be as excellent as when you are relaxed. So these are stressful times. If you need help, look for the elderlyaffairs.com website, or there are also support groups available like Alzheimer's Association that hopefully will help you.
Yeah, I
Thank you.
often refer my families to support groups. There's some really good caregiving support groups that make, to know that other people are going through the same sort of stress and dealing with it and how they deal with it. And then, I find that adult grandchildren often are a saving grace. Grandkids and grandparents have a different relationship than we do with our parents, and sometimes they have more patience. And are able to pitch in. And if you don't ask, you won't know. So
That's for sure. We're going to continue our webinar for just a little bit longer for those of you who are able to stay on so we can answer a few more of these questions. We got one question about acute care that I think we would be good to address. What do I do if, I have, an elderly person home who's say, 93 and they suddenly spike a fever? What should I do?
Want to answer that? Well, so the best thing to do is to isolate that person and then, call their primary care provider. Uh, because usually we will ask you some questions to see whether the risks that your loved ones have of getting COVID, and then go from there. Your primary care physician will know a lot more about you. We have to get more information. I guess a fever is not just a fever. It could be a presentation of something else. So working with your provider, that's why there's a lot of ways for you to connect with us now, so that we can help you. Because you can just give someone with a fever Tylenol, you know, but we don't know, if we don't treat the cause of that fever will just keep coming back. What if it's COVID? That's what's always on our mind. Is this COVID? Someone spiked the fever. We don't know. It could be just like a urinary tract infection, or they just got tired, because the it's very warm outside, temperatures fluctuate throughout the day. I think the best thing to do is contact your healthcare provider so that we can help you with that, so that you don't get to be just shouldering the worry by yourself.
Yeah, I think that's the key, is to make sure that you contact your doctor as quickly as possible, and we can help you assess that.
there is a COVID hotline for HPH as well. That might be a good place to start. And I know a lot of folks have been using that to worried about COVID.
And we have a virtual COVID clinic people can take advantage of as well.
Right.
Um, Let me ask, we'll just do one or two more questions here. What about the flu vaccine? Is that a good idea for our Kupuna?
Absolutely. Flu vaccines are out, and I've been going around giving some of them already. So if we can get more of our folks vaccinated at this time, that would be great. Maybe one less virus that we can get infected from. And I don't know when COVID vaccine is coming out. I mean, we are told different stories every day on the news. So if we can at least do our flu vaccines now, and if the COVID vaccine comes in a little later in the year and early next year, at least they won't be overlapping.
Yeah, and that'll be one less concern and one less reason that people will get a fever.
Yes.
I'm going to try one last question here. What support services are available for elderly patients who live alone?
Support services meaning like caregiving supports, or what?
I'm thinking
I
food,
guess.
shopping,
Oh, there's
Yeah.
Meals on Wheels.
Yeah.
That's a service that I think all the islands have. They provide warm, like hot cooked meals delivered to their house on a weekday, I think. And there are, businesses that offer like delivery services for groceries. There are also Kupuna hours for a lot of your favorite stores. Those things are very helpful. Another thing is reach out to your senior centers. See, they might not have in-house activities available, but a lot of the senior centers, I just watch it over the news. Like one of the facilities in Oahu, like Lanakila, I think, they
Mm-hmm.
have exercises through video for people who used to go to their facilities. So I think reaching out to your community centers might be very helpful. And again, elderlyaffairs.com, they have resources there for you to if you need help for homemaker like cleaning the house, doing the laundry, like once a week. They do have people do that, and sometimes they're even provided for free. It depends on what the funding is available at that time. But here in Kauai, we do have that with the elderly affairs.
Yeah, I think
There's
that
also stuff like Catholic Charities. Even some adult daycares are still operating under these conditions. So those are some other things you can.
Well, I think that's all very helpful information, and a lot of it is accessible online. Ladies and gentlemen, we thank you all very much for joining us. That's the time we have. And I really want to thank our panelists who took the time today to provide the insights for families and those who are watching at home. We hope you were able to gain some useful information to help keep your kupuna safe. As you've heard throughout today's program, Hawaii Pacific Health offers comprehensive services that can support the medical needs of you and your family. From virtual video or phone visits or in person, we're here to help keep you healthier. If you have questions regarding the services or today's webinar that we provide, please visit hawaiipacifichealth.org. Thank you for joining us today, and we hope you and your family stay healthy.